don't see anybody waiting out front, so let's go ahead and get started. So welcome to our dedicated Medicare event. My name is Carl Burlbaw. I'm the Assistant Director for the Elder Financial Safety Center here at the Senior Source. And so let me kind of tell you how we see this going, this event that you're attending today. So in this room, we're conducting a general information session about Medicare. We'll just kind of go over very kind of high level, the different parts of Medicare. We'll talk about enrollment periods, things like that. Once we've concluded, and this should be about 30-40 minutes, I expect, we'll leave some time at the end for questions. So if you could hold your questions until then you will have the opportunity to go across the hall, and that's where we'll have counselors are there to, you can meet one-on-one with a counselor here from the Senior Source to talk more about your situation, get more, ask more specific questions regarding, maybe if you're, by the way, who's already enrolled in Medicare? Okay. Yeah, so you can ask questions, about, if you want to switch out a drug plan or Medicare Advantage, maybe what you have or what you're, just some very specific questions. Maybe you have other insurance that you have, and you're just not sure how that works with Medicare. Okay. So, any questions before we begin? So the topic is called Navigating the Medicare Maze, because welcome, come on in. Mr. Clements, how are you, sir? Good to see you. So Medicare, I've done Medicare counseling for 10 years now, and it can become like a maze. You think you're going in the right direction, and then boom, you hit a wall, and you're like, okay, now what? Where do I go? So we're here to help you try to navigate that, because it can be kind of tricky sometimes, depending upon your situation. So let me give you a little bit of background about myself. Again, my name is Carl Burlbaw. I've been here at the Senior Source for 9+ years. My area of expertise is in health, life, long-term care, and Medicare. My favorite food is Diet Coke. Okay. So, speaking of, well, not too much fat in that, but it's a vice of mine. Definitely a vice. My first job was actually at Blockbuster Video. Who remembers Blockbuster Video? It was actually at the store that's right over on Lemon. It used to be on Lemon Avenue. It's no longer there, but it used to be on Lemon Avenue. And actually, I met my wife there. We just celebrated our 25th wedding anniversary. So thank you, Blockbuster Video. So yes, there's a Blockbuster Video success story. So, all right. Oh. Sure. Will you just pass, for those who need a copy of the PowerPoint, we pass that down. Thank you. All right, so let me just talk a little bit about our program here at the Senior Source called the Elder Financial Safety Center. So our focus with our program is financial security for anyone age 50 and older. And so what you see on this slide is our program is a unique, first of its kind, in that it's a collaboration between 3 separate entities. You see on here at the top, you see the Senior Source. We're about prevention services. You have the Dallas County District Attorney's Office. They're about prosecution when it comes to crimes or financial crimes against older adults. The Dallas County Probate Courts, they run the guardianship program in Dallas County. So if anyone gets to the point where they cannot make decisions on their behalf and there's no one there to step in, then maybe guardianship is the next appropriate step in that case. And so you can see we actually share a database so we can actually refer cases to each other. And let me just go over the prevention services offered by the Senior Source. We have technology education. Oops, put those phones on silent for me, please. Financial coaching, benefits assistance, money management, budgeting, insurance counseling, frauds and scams, health, debt management, financial literacy, exploitation, prevention education, and also essential needs support. So again, anyone age 50 and older is eligible for most, if not all, of our prevention services here at the Senior Source. Okay, so why us? Why do we think you should choose us? And it's for these reasons right here. We're a safe place, judgment-free. We are very supportive, caring when it comes to Medicare or any type of financial advice or information. There's no pressure. We're unbiased. We're not going to see ads. No ads. No, there's no commissions. We're not here selling or representing any products. Okay. So again, we're offer completely objective and unbiased information. We're just focused on whatever your specific needs are.
Nonprofit.
We are, yes, we're a nonprofit, mostly private. Good question. We're funded by private donations, grants, foundations, things like that. Yes, good question. Thank you. All right, so today we'll talk about turning 65, what that means, especially in terms of Medicare. We'll talk about enrollment periods, talk about different options in terms of how to get your benefits. We'll focus a little bit on some things that are new to Medicare for 2024. And then we'll talk about a big problem that we all need to be concerned about and try to do something about is fraud, waste, and abuse in Medicare. All right, before we get into the nuts and bolts and start talking about Medicare, let's just talk about some things that go along with, as we get older. I mean, 65, is it still that magical age of retirement? It is still age when people can become eligible for Medicare, but I don't know if it's still that age when, you're able to retire. I think many people are now working longer because they're living longer, so they have to try to maintain as long as they can. But some of the things that we should also focus on as we get older, the opportunity to maybe travel, experience new places, spend time with family, friends, spouses, maybe get to know each other better. Be glad that you don't have to be on a schedule any longer, right? Turn that alarm clock off. Or maybe even explore new hobbies. Maybe find out what are your interests and focus on those things and spend time with those things. So Walt Disney said growing old is mandatory, but growing up is optional. All right, big picture with Medicare, big picture. All right, so in 2015, we had 54 million people on Medicare. In just last year, we had a little over 65 million. And by 2030, it's estimated we're going to have 80 million people on Medicare. So did you know that in this country, every day, 10,000 people are turning 65? Mm-hmm. That's the baby boomer generation from now until 2030. Okay, so that's where all these people are coming into Medicare. All right. This year, Medicare spending is expected to exceed $1 trillion. Again, it's a big part of our healthcare system for sure. All right. This is just a visual of what Medicare looks like as far as how you can go about getting your benefits. Okay, so first of all, you enroll into Medicare through Social Security. So it's based on your work history. If you qualify, if you've received 40 credits, or maybe through your spouse, you can do so. Then you can enroll in what's known as Part A and Part B. And that becomes your primary for medical. Part A covers you if you're admitted as a patient to a hospital, and then Part B covers doctors, outpatient services, durable medical equipment, things like that. So that is your primary for medical. Then Part D is for prescriptions, prescriptions that you get filled at your pharmacy, or even some vaccines. Medicare says that if you're eligible, once you become eligible, you must have some form of prescription coverage in place. Okay, now some people I know at 65, they're like, well, I'm not even taking any prescriptions. I don't have to take anything. Well, I understand that. I'm just telling you, here's how it is. This is what Medicare says. Okay, so So that's kind of, again, the way I look at Medicare is kind of like this game that you're about to play. And what's one of the most important things before you start playing a game?
Know the rules.
Exactly, know the rules. That's right. And then below that, you see this word Medigap, or also known as Medicare Supplement. This is actually a secondary policy that you can purchase. It's private insurance, and it goes along. It's a secondary to Part A and B, because Part A and B doesn't cover everything. So the purpose of this is to have that secondary policy to cover those costs, like coinsurance. Like Medicare Part B is a 80%, 20% coinsurance, where Medicare covers 80% and the patient is responsible for 20%. And that's where the Medigap comes in. Okay. So that's one side of a path that you can choose. So it's kind of like a fork in the road. The other side, Medicare Advantage or Part C. So this is private insurance through any number of health insurance companies. I'm sure we're seeing lots of ads right now. Joe Namath is a very prominent spokesperson for that. This is a combination of medical and prescription and plus other benefits like, say, dental and vision and fitness, transportation, over-the-counter allowances, things like that. Now, as I said, Medicare Advantage already includes Part D. So if you're on a Medicare Advantage plan, you don't have to go out and get a separate Part D prescription plan. The benefits are already built in. Yes?
Is C, A, B equivalent?
Correct. Correct. C must have at least the same benefits as if you had A and B as your primary. And it could be more, it could be better, but Medicare says it must have at least.
If you don't choose, you will be fine. I was fine because I didn't choose, and I was told not to choose. I didn't need to choose. That's when I first did that. And then next time I know I had to deal for $5 or $10 because I didn't choose.
Talking about Part D?
Yeah. But I was told not to when I called SSA.
No.
Okay. That's one of the things, to that point, that's one of the things that that we really try to stress here is it's easy to get information, so easy, just swipe your phone, get information, right? Is it the right information? Is it a reputable source that you're using? That's what one of the things we want to try to convey to you through this.
Social Security told me when you answer the phone.
Well, you're only, I'll tell you about Social Security, it's only as good as the person you're talking to.
Okay.
So, if you're on a Medicare Advantage plan or Part C, you cannot get a Medigap. They don't work together. Okay, so if somebody is trying to sell you a Medigap, but you're on Medicare Advantage, you have to first disenroll from the Medicare Advantage, go back to having Part A and B as primary before you can purchase the Medigap.
So what does Medicare cover?
What does it cover?
Yeah.
The costs that A and B do not. Like mainly it's the 20% coinsurance that Part B doesn't cover.
So it's the same like C.
What's that?
It's pretty much the same. Like
No, it's not. It's not. C is different. C has very clear costs for services. Okay, whereas Medicare is, like I said, mostly 80%, 20%. Depending upon what the service is. Okay, a doctor that accepts Medicare has said, I'm going to accept whatever Medicare is paying for that service. Let's say it's $1,000 as an example. Okay, $1,000 is the cost. Medicare is going to pay 80%, which is $800. Your doctor is going to bill you for the remainder, the 20%, which would be $200. This, in theory, will pay that $200 for you. But you pay a premium each month for this just to have that in place. It just depends. It's not, no, I mean, to pay for the Medigap?
Yeah, your benefits, it's automatically paid, because I know when I automatically pay off maybe $60 or $74 a month. It automatically takes it out. So, SSI automatically take it out for Medigap or
No, Medigap, you have to work out payment between you and the company. So,
And if you've got Part C and you don't need Medigap, do you have deductibles?
Depends on your plan. Depends on the plan. Each plan is going to be different. Each Medicare Part C is going to be different. Depends on your plan. Okay. Let me just back up just a bit, if I may. We've had some people join us since we started the presentation. Again, how we see this going is in here this morning is a general session, general informational session. You then have the option, and some of you, if you have numbers that you were given, those numbers you can take into the room across the hall and see a counselor one-on-one. If you after the session, if you haven't gotten a number and you want to see a counselor, you can go back out to the front desk. She'll assign you a number, and then you can go in and see a counselor.
What number right now?
What now? No, you can go after this session is over and then get a number. Yes.
Are the counselors from the seniors?
There's some of the senior source, yes.
So anyway, write our questions down that we have and take it to the guys over there.
Well, I'll answer questions after this, but if you have questions specific that you want to really if you want to get into real details, that would be more appropriate for a one-on-one.
Okay.
Okay?
Thank you.
All right. Did she go get a number? I told her she could. Okay. All right, let's talk about options. One of the main questions we get when it comes to Medicare, tell me the difference between original Medicare and Medicare Advantage. So let's see if we can clear that up. All right, original Medicare, again, that's Part A and B. Freedom to choose providers. In theory, if you have Medicare Part A and B, you can go anywhere in the United States and see a doctor that accepts Medicare. Okay? You have the option to purchase the Medigap. We already talked about the Medigap, the secondary policy to offset the costs of A and B. You do have to get a prescription drug coverage that's separate from A and B. Okay? And original Medicare, again, is medical only, doesn't offer benefits for dental, vision, any of those other services. Okay. Now let's look at Medicare Advantage. Medicare Advantages are set up like either, let's say, an HMO or a PPO with networks of providers, doctors. Depending upon which plan, HMO can be very restrictive. It says that you must have a primary care physician assigned, and then you must get a referral from that primary care before you can see a specialist, or the insurance company won't pay. PPO allows you some freedom to go outside of the network, but you're still going to have to pay something. It just depends on what. Medicare Advantage has what's known as a maximum out-of-pocket. So let's say, for example, you're on a plan that has a maximum out-of-pocket of $5,000. That means that at some point, if you're out of pocket for the year, totals $5,000 through co-pays or deductibles, things like that, then the plan will cover you 100% for the remainder of the year. So, as we said before, Medicare Advantage includes prescription drug coverage, and then it also may include other benefits like dental, vision, and fitness. Here's what I say about Medicare Advantage. Two things. If you're considering Medicare Advantage, two things that you need to take into consideration. Will the plan allow me to see the doctors that I want to see? And will my prescriptions be covered? Those are really the two main things that need to be addressed. And from there, you can focus on things like dental, vision, other aspects. Yes, Mr. Clements.
Are you saying then that if you're under the original Medicare, and you have a prescription drug coverage, they cover things, prescriptions that your Medicare Advantage will not cover?
Say what? I'm sorry, say that one more time. I'm sorry, I got it.
All right. If you're under Medicare original, you have a prescription drug coverage plan called plans, Part C.
No, you said original Medicare and Part C. Those are two different things. Part C is Medicare Advantage. Original
Part
Medicare
B,
is
I mean, Part B.
Part D. Part D.
Part B. Yeah, Part D. If you're under Medicare, are you saying that original Medicare, Part B, might cover some pharmaceutical prescriptions that are not covered by Medicare Advantage?
No. No, each plan is gonna have its own formulary. Medicare Advantage Part C or Part D prescription drug plan is gonna have its own formulary. That's why it's important to compare your prescription. You don't just, you compare your list with the formulary, and that's where you can, when you seek one-on-one counseling, that's where you can get help. And you and I have done that in the past.
Yeah, well, I've got Medicare Advantage now.
Oh, okay.
And I am really confused because I thought it was supposed to exempt me from copays. And I don't think that's the case.
Again, it's every plan is different. Every plan has its own formulary. A formulary
Every
is a
Medicare
list.
Advantage plan has a different formula.
Correct.
Gotcha.
Yes. Every plan that offers drug coverage, either if it's Part D, a standalone plan, or Medicare Advantage, medical and prescription, it's gonna have its own formulary, and a formulary is the list of drugs that are covered under that plan. Okay,
Is there a plan like you said that exempts you from having money?
What?
Monthly payment?
it just depends. Each plan is different. You just have to compare your prescription list with the plans that are available and see how it matches
So
up.
I'm saying, but is there, I hear what you're saying, it depends,
Mhm.
but to your knowledge, is there any plans out there that exempt you from having to come out of your pocket?
Exempt you mean where you pay nothing?
Yes.
Every plan is gonna have a premium.
Yes. that
Every
comes
one of
out
these plans is
automatic.
gonna have a premium that you have to pay
I
to
got
enroll.
That comes out automatic.
It depends. If you're taking generics, maybe if you're taking some generics, sometimes generics that are tier 1, you don't pay anything out of pocket. Again, it depends on the plan. Okay. All right, let's talk about, give me 1 second, please. Let's talk about enrollment periods. All right, let's talk about what's known as initial enrollment period. That's the period that surrounds your 65th birthday when most people become eligible for Medicare. Okay, so it's a 7-month time period, starts 3 months before the month you turn 65 and goes 3 months after. Includes the month that you turn 65, so that's 7 months. And that supersedes the annual enrollment, which is what we're in right now, October 15th through December 7th. So it can be very confusing. If somebody's turning 65 in February of next year, and they're seeing ads that say, you must do something by December 7th, what do you think they're doing? Like, I need to do something. I'm turning 65 next year. Slow down. It's okay. You have your own enrollment period. Don't worry about these ads that you're seeing now that trying to get you to do something before December 7th, okay? If you're already taking Social Security benefits at 65, you'll be automatically enrolled and you'll be issued a Medicare ID card. If not, you have to initiate enrollment through the Social Security Administration, okay? If you're on disability benefits before age 65, after 24 months of receiving those benefits, then you're eligible to receive Medicare. Okay. If you're diagnosed with renal failure, kidney disease, you could be automatically enrolled into Medicare. And also one of the things on ALS, if you're diagnosed with ALS, Lou Gehrig's disease, you can be automatically enrolled into Medicare. Okay.
Question.
Yes.
I turned 65 in January.
Mhm.
I've got marketplace insurance now that's going to be renewed.
Okay.
I've applied for disability. They denied it first time.
Mhm.
If it's approved during this first year, how does the disability change? Does the disability payment change, or does it stay with the net?
I think that's going to be a question for a one-on-one session. Thank you. All right, special enrollment period. So if you're still working at 65 and you have your employer health insurance, that's going to be your primary. As long as you're actively working, that's going to be your primary. And so if Medicare would only be a secondary until that goes away. And then let's say you want to retire at 68. Okay, so you've worked past 65, you had your employer health insurance. You can apply for a special enrollment period through Social Security, and have your own, just like if you were turning 65, have your own enrollment time. And what that can also do is help avoid a late enrollment penalty. Because if you don't enroll in at 65 into Medicare, but you don't have other insurance, and then you decide at some point later on to go on to Medicare, you could be penalized for the time that you went without.
Repeat that one more time.
If you're still working past 65, whenever you decide you want to enroll in Medicare, you can do so. You just have to, there's some forms that you have to submit to Social Security. And that allows you the special enrollment period, whenever that is, and it helps avoid a late enrollment penalty.
So I know you said no question, but with Social Security, know this would be like you said, it's who you hear from. But when I go to Social Security office, they tell me what you just said.
Well, there's a form that you submit to Social Security. Part of the form is your employer verifying that, yes, Jane had insurance through us until this time. Okay, so that's showing proof of coverage that allows you that special enrollment and then shields you from that penalty.
And one more other question, I know you said, but so then after that, I won't be penalized, right? Correct? Is that what you're saying? Okay.
That's right. So that's special enrollment. You can also get a special enrollment. Let's say you moved. Let's say you've lived in California, you've been on a Medicare plan that's specific to California. Now you've moved to Texas. You can get a special enrollment period for that. Okay. Open enrollment. Okay. This is for if, let's say you're on a Medicare Advantage plan. Let's say you signed up for a Medicare Advantage plan during this enrollment time before December 7th, and then that coverage will take effective January 1. Starting January 1, you're on this new plan and you're going to see some doctors and you're getting your prescriptions filled and you realize, you know what, it's just not working for me. It's not what it was promised to be. Between January 1st and March 31st, you can switch out of that plan that you enrolled in. You can switch and go back to original Medicare. You could select a different Medicare Advantage plan. And then also, if you leave your Advantage plan and go back to original Medicare, that means you're going to have to get drug coverage. So then you choose, you can get the option to choose a standalone drug plan, and that decision you make during that time will carry on until the end of the year.
Let me make sure I understand you. I am in an Advantage plan now, but I don't like it.
Mm-hmm.
So I decide to change to another Advantage plan. And I can without penalty.
That's correct.
Okay, let's make sure.
That's correct. Also, this is a time, if you did wait till after your initial enrollment, 65, you didn't apply, you didn't enroll in Medicare for whatever reason, but you didn't have other insurance, so you're not given a special enrollment, then this becomes the enrollment time to get to enroll into Medicare after your initial enrollment without a special enrollment. I know that can be a little bit. Yes, sir.
So if I have marketplace insurance now,
Mhm.
I enroll in Medicare in January,
Mhm.
which is the primary?
Which is the what?
Which would be considered the primary insurance?
Well, you're turning 65, right?
Right.
Do you qualify to go on to Medicare?
Yeah.
Then that's your
So
initial
that'll be the
enrollment.
primary, and then
Yep.
then anything else.
So you'll
will be
have,
secondary.
you turn 65 in January, you'll have February, March, April to
Yeah,
complete
they've
your
already
enrollment.
sent me the card on it.
Okay.
That could be primary.
Okay, Medicare and other insurance. So if you have other insurance and you're not sure how it works with Medicare. So let's say maybe like we already talked about, you're still working at 65 and you have employee group health. Maybe you're part of a retiree program like TRS, Teachers Retirement. Maybe you're a veteran and you have veterans health benefits, or maybe you're eligible for TRICARE. Maybe you're a federal or government employee. Okay, that's known as coordination of benefits. It's how those other benefits work with Medicare. Medicare is Medicare primary, or what's primary, what's secondary? Who's going to pay first? Primary means which coverage is going to pay first. Okay, so that's something else to consider if you have those other options. Yes, sir.
I thought TRICARE is for federal government.
It's a veteran. I believe it's a veteran's benefit.
Veterans.
Yeah, for specific. I think it's for specific people. I'm not sure how, but it's yeah. All right, let's talk about Medicare math. All right, so there's something called the Income Related Monthly Adjustment Amount, or the acronym is IRMAA, I-R-M-A-A. And this is where, based on your tax return, they can add an additional fee to your Medicare Part B premium. Okay? And they look back 2 years to your tax return. And that can be added to your Part B and your Part D premium. So this year, Part B premium, if you're on Medicare Part B, you're paying $164.90 a month. And if you're above these limits here on your tax return, single $103,000, married $206,000, you could be paying more on top of that. Okay. Yes.
I'm told that you can appeal that.
Yes, there's a form with Social Security, I think, that you can appeal. I would just Google IRMA form, and it's probably you probably find that. Yes. So.
And that only applies if you're over your 102,000 or more?
This is going to be for 2020. This is for 2024. This is it's a sliding scale that changes every year. So.
I thought after you get a certain age, well, 66, what after you get 66, a few months after your 66th birthday, 3 or 4 months, you can work as much as you want without being penalized.
That's Social Security. That doesn't apply to Medicare.
It doesn't.
Yeah, I think you're talking about Social Security retirement benefits before full retirement age.
I thought that transcended over into Medicare as well. It doesn't affect you.
This is just strictly this is just for Medicare, the what you pay for Medicare.
There are probably counselors, if I ask that question.
Correct.
Okay.
They'd be, yeah. Yes. All right, let's talk about costs for Medicare. So this is updated for 2024. I just said that the Medicare premium this year is $164.90. Next year it's going to be $174.70 a month. The Part B deductible, which again, that's what you pay out of pocket before Part B starts covering 80%, 20%. That's going to be $240 for the year. Part A deductible, which is if you go into the hospital, admitted as a patient to the hospital, that's called a benefit. So that covers a 60-day benefit period, and that cost is $1,632. Yes.
So if you had Medicare Advantage, would it pick up that deductible?
Medicare Advantage it would have its own costs. Different. Yep. Medicare depends on the plan. I'll give you an example. Medicare Advantage plan will probably say cover the first 5 days of a hospital stay and like $250 per day copay. And then after that, it will be no cost for like up through 90 days. Okay. Yes.
If you opt for an Advantage plan under Part C, are you dumping Part A, B, and D?
You're not dumping it, you're replacing it.
So you don't have to pay the Medicare.
You still have to pay the Part B premium. Yes, you still have to pay that.
Oh,
You pay that to be enrolled in Medicare.
okay.
Once you're enrolled in Medicare, you have the option. Do I want to be on original Medicare or do I want to go with Medicare Advantage?
Thank you.
For the cost for Medicare Advantage plans to be enrolled, most HMOs have no additional premium. PPOs usually will have an additional premium that you have to pay to the plan. Copays, if you're taking insulin for diabetes, insulin should now be capped at $35 copay.
That
Okay.
only in the regular Medicare, or is that?
Correct, that's Medicare.
So it's not in the advanced ones?
No, it should be across the board.
Across the board.
I think, do I recall correctly that there was a squabble over how much you had to pay for this rinky-dink applicator that basically blasted the plunger of that spring, and they were something like $300-400.
Oh, the Lansing devices,
Pardon?
the Lansing devices.
Yeah, whatever you call that, that probably was cost $5.
I don't,
You don't
that I don't know. No, sir.
This is just for the actual insulin itself.
One other thing to point out, vaccines such as shingles are free under your Part D plan. Okay, so shingles vaccine can be covered under your Part D plan. All right, Medicare fraud, waste, and abuse. So you see fraud with Medicare most common in these areas: hospice, home health, community fairs. If you ever go to a health fair and they're saying we're giving away, we're doing free blood sugar level tests or something like that, swab, but they ask for your Medicare card or your health insurance card. Why is that if it's free? Right? that shouldn't happen. Okay. So that's a red flag for sure. Medical billing. So the volume of medical billing right now is just, who has time to go through all of their, all of their statements, the coding and everything. Who's doing this medical billing? People, right? Human beings? No. Do human beings make mistakes? Maybe AI, right? And, do humans make mistakes?
Yeah.
Absolutely. We need to be checking, we have to be checking this information, make sure that it's correct. Otherwise, if we don't, it just compounds. I had a woman just call me yesterday. She has a dental benefits under her plan. She went into a dentist's office recently and she had to wait so long that she just left without getting service. Then she just tried to go into a different dentist's office to get service. They said, I'm sorry. They said, you got this cleaning back on October 10th. I was like, no, I didn't. Well, that was incorrect. So hopefully she gets that corrected. There's an organization called Senior Medicare Patrol. They go out, it's a volunteer organization, they actually go out into the community and do presentations and educate about fraud, waste, and abuse with Medicare. This organization, their motto is detect, protect, report. Okay, so detect any type of inappropriate or suspicious activity, protect your information, and then if you think something illegal is going on or suspicious, you can report it. And this is their information here in Texas, the headquarters. The Senior Source actually sponsors a chapter, Senior Medicare Patrol. We have volunteers. In fact, Debbie, who's at our check-in table this morning, she's actually a volunteer that goes out and educates about fraud, waste, and abuse with Medicare. It's a big problem. I think it's 60 billion or something like that in losses every year. So again, something we want Medicare to last. It's something that we need to try to turn around. And then real quickly, I just wanted to kind of make you aware of the differences between these two things, Medicare and Medicaid. 10 years ago, before I started doing insurance, I didn't know the difference in those terms. I didn't know what Medicare was. Medicare, Medicaid, seems like it's all the same, right? Well, it's not. Medicare, again, is health insurance for those age 65 and older. It's based on your Social Security work history. Okay, income's not a basis for eligibility with Medicare. Okay, Medicaid, however, is it's based on income and assets eligibility. There's a program called Medicare Savings that you can apply for, and it can help pay for some of the costs of Medicare, like the Medicare Part B premium. It can also be a secondary to Medicare. There's a term called dual eligible. It means you're eligible for both Medicare and Medicaid, okay? Right here, dual eligible. So you can actually, there's private insurance companies that offer what's known as dual eligible Medicare plans, so you can get Medicare and Medicaid benefits from the same provider. And then also Medicaid can cover things like long-term nursing care, okay? All right, yes, Mr. Clements.
Okay, go ahead, ma'am, go ahead.
Okay, can you please explain how you get Medicaid?
How you get Medicaid?
Yeah.
You have to apply, with the state, Health and Human Services. And again, it's based on your income and your assets.
But if they based it on your income from when you work, they would tell you you make too much money.
Okay.
That's what I run into.
Yeah, they would tell you that, based on your work history and what you're getting, that's too much money, so you're really kind of out on that one.
We have counselors here that counsel people on enrollment into state benefits, like Medicare savings, like SNAP, which is, formerly known as food stamps, supplemental nutrition. Okay.
Thank you.
All right. So again, Medicare counseling, this is something that we're really emphasizing here at the Senior Source. Again, mainly for the reasons I told you in the beginning. We're unbiased. We want to provide a safe environment for you. We're not going to tell you what you should do. So I know you want to, sometimes I get questions all the time. What's the best plan? Tell me, what's the best plan? What do you think I should do? I can't tell you what you should do. Here's what I can do. I can give you the information and lay it out for you, okay? Lay it out however you want to see it. Let's lay it out. Is it about numbers? Is it about this? I'll help you lay it out so you can understand it. So then hopefully you get to a point where you're comfortable making those decisions, okay? Yes, we're trying to empower you. What's that?
Is the counseling available all year long or just?
All year long, absolutely. I mean, obviously right now it's Medicare enrollment time between now and December 7th. So things are heightened. I mean, people, see ads. I mean, we're seeing ads all the time, television, radio, social media, mail. I'm sure if you're turning 65, you've been inundated with mail. So I tell people, what should you keep? Keep whatever's from Social Security or maybe the state, Health and Human Services, everything else you can just discard. Okay. Again, this is my direct information, 214-525-6172. Here's my email. This is my number one resource for Medicare information. This is my go-to, medicare.gov, on their website, www.medicare.gov, and then there's Medicare's phone number, okay? All right, just a couple more questions, and then we'll conclude, and I'll allow you all to go have the opportunity to meet one-on-one with a counselor.
Could you go back one slide, please?
No, I don't have a number, but I can.
Okay, the second under Medicaid, the second little block says Medicare savings.
Yes,
But why is it under Medicaid and not under Medicare?
because it's a program funded by Medicaid. Medicaid is federal dollars that are offered to each state to how they want to spend those dollars. That's why each state has its own Medicaid eligibility.
How do you determine that you're eligible?
Meet with a benefits enrollment counselor, which we have here. Or you can call Health and Human Services, either one. But we like to help you deal with Health and Human Services. So, no, great question. So Medicare savings is to help offset the costs of Medicare. So you have to be enrolled in Medicare to apply for this benefit. Hi, Julie.
Hi.
How are you?
Hi, we have a VIP question.
Okay.
If you have Medicare Part A, regular Medicare plan and not Advantage, do you have to have D?
If you don't have D prescription, you could be penalized at some point if you decide later on to enroll in Part D.
Got it, thank you.
You're welcome, thank you.
I'll learn something.
Yes, and so great, she brought up a great question. You can actually, to get, and I hope you all picked the handouts that we have on the table outside. I hope you all picked up well, it looks like one of my first slides. Let me get back to that. Oh, it looks like this slide here. Did y'all pick up, it was out on the table out there. Did y'all pick up a handout? It kind of looks like this. I think that one, yes, if you hold that up. This, okay, so what Julie asked was about Part A, hospital. You can actually have Part A, not have Part B, but still get Part D. Okay? All right, so you can, to get Part D, you must have at least A or B. And then for Medicare Advantage, you must have A and B together. You can't, so I know a little bit complicated. Again, all the moving parts of Medicare, so. Yes.
Is there a secret to how much D costs?
Is there a secret to how much D costs? No. So let me give you an example. If you have an area code, a zip code that's in the Dallas area, you probably will have between 20 and 25 Part D plans available to you. And I'll give you an example. The lowest cost plan this year is 50 cents a month. 50 cents a month. The highest is probably over $100. It's a wide range of costs. Again, that's why I say it's about your individual prescription needs, your plan matched up with each of the plans, those formularies.
So you have to shop for D on
Correct.
your own.
Shop, or we can help you with that. We can go through the process with you with that, show you how it works. So.
And you said according to zip code.
Yes. Yes, because every insurance is about zip code.
Yeah, I know.
Okay, you know, so I know you're giving me a sad look or a concerned look about that. So
That's not right.
I'm saying doesn't make.
I mean, it's not, it doesn't, I know what you're saying. It's just, if you live in let's say you live out in the country, let's say you live out in Hunt County or Kaufman County. Well, you're only gonna have you're gonna have fewer options, probably because there's fewer providers out there, right? I mean, we live in a city where every street corner has at least 3 pharmacies, right? And so you have options on which pharmacies to go to. I mean, so it just depends on, that's what it's really about. It's when they ask for your zip code. Okay.
And if you move in the year,
If you move, you should let your plan know. Well, you let Social Security know, or you let your plan know, so they can then provide you a special enrollment to find a plan that serves your area. Okay, so it's on you to come forward with that information. Okay. All right, so who has a number and would like to see a counselor across the hall? You may proceed and go across the hall and then sit down and they'll call your number. Those who didn't get a number would like to see a counselor, you may go back out to the front desk to see Debbie and she will give you a number.
Okay, yes, we will, but she said we can have, do you need to have me right back?
If you were given the intake form at the front desk, that's for you to fill out and give to your counselor when you see them one-on-one, okay? That's information for them.
Oh, they didn't get it.
You can get one at the front desk, so. Thank you all, appreciate it.
Thank you.
Thank you.
Just had one moment. I'll get one moment to come back in. It's just,
I'll be back.
it's just one.